Do you suffer from headaches, like chronic headaches? Sometimes you get them a lot this time of year in particular, or migraines. Well, if you do, that you know that there is precious little relief for you. But a new breakthrough may help you, and it may help all people who get severe headaches, and it doesn't involve any drugs. 2 studies suggesting that technology may be the answer to your headache woes. Here with the details is emergency room doctor Lee Vinokur. Good morning, doctor.
Good morning, Megan. How are you?
I'm doing well, thanks. I find this interesting because the one, you do it to yourself. It involves some handheld device. What do you put it on the back of your head? Tell us what you do with it.
Yeah, it's transcranial magnetic stimulation, TMS, and it's like the size of a blow dryer. And migraines, people get neurologic symptoms first, so like an aura, so they get tingling, flashing lights. So during that aura period that precedes the headache, you're supposed to put it to the back of your head, and it emits a small current through magnets, and it sort of interrupts the flow, because what a migraine is it's an abnormal electrical response that then leads to swelling of the blood vessels that then leads to the headache and the symptoms.
Does that work on, because the study said it was not just migraines but also just headaches, but is that not the case? Does this only help migraines?
Well, this device can do sort of any garden variety, and tension headaches sometimes start with muscular tension, so it can interrupt the flow of the muscular tension too. The second study, which was an implantable device, was really for people that had serious migraines that didn't respond to any medication.
And tell us about that. You get something implanted in your brain to stop the migraines?
Well, it's not so much implanted in your brain, but it's implanted in the back of your head. The way that they do spinal stimulation and nerve stimulation for bad backs and sciatica, and it stimulates the occipital nerve, which is one of the cranial nerves, and that also interrupts the electrical flow, and it interrupts the pain receptors that sort of cycle and cause the headache.
Yeah, and they said that something like 40% of the patients got a lot of relief, particularly from that second thing. All right, so if you have chronic headaches and you don't want to get the thing implanted in your someplace in your skull, and you're interested in that hair dryer-like thing, where can you get it, and how soon can you get it?
Well, they won't be selling it at Target anytime soon. No, this was a very small preliminary study, so they have to do more studies now. So it's probably several years down the road before you can get it. But I think it's a good start to doing something besides medicine, because it can be a debilitating disease, and a lot of people get addicted to the pain medications because they're always in chronic pain, and it causes depression. Yeah. So I think this is a step in the right direction.
Absolutely. So it's promising in any event. Dr. Lee Vinokur, thanks so much.
My pleasure.
Wow. That's hopeful.
That's cool, right?
So many people are debilitated, utterly debilitated by migraines.
If you live with chronic pain, no one knows how you suffer. I mean, that is true agony. So maybe this can provide some relief.
All right, good.